And now we're going to be moving on to our fourth video on cognitive behavior therapies. And we're going to continue on with a couple more rituals. This next ritual of mindfulness is one that's particularly important to the third wave of cognitive therapies, things like DBT and ACT. So mindfulness is essentially a way of being grounded in the present moment. And the kind of insight behind that is that when you're anxious or feeling distressed, usually you're out of touch with what's going on in the present moment. Distressed or anxious thoughts are either past or future focused, and using techniques such as grounding techniques can help you to reconnect to the present, feel calmer and safer in the here and now. Most of the techniques that are used in grounding and in mindfulness focus on some aspect of your five senses: touch, taste, sight, sound, and smell. The reason for this is of course that your senses are in the present. You can't smell something in the past. Actually, that's not entirely true. Sometimes you can. But typically you can only touch things, taste things, hear things, see things, and smell things in the present moment. And the process of heightening your awareness of your surroundings through your senses and increasing your awareness of what's going on in the interior of your body, considered sort of the sixth sense, creates a clear, aware, open, peaceful, calm hub at the center of it. That you are this person who is experiencing this present moment fully and non-judgmentally. Like I said, there are some easy practices related to grounding. The first would be grounding something to sight, so looking at something that is blue, or noticing 7 things that are blue. Grounding to sound, for perhaps listening to a guided meditation or listening to sounds of nature recording. Other things can be as simple as pressing your feet firmly to the ground to remind yourself of where you are, or maybe carrying a polished stone or soft piece of cloth in your pocket for you to touch. Maybe carrying a soothing picture with you and looking at it when you're feeling anxious. Noticing where you are, including the people, sights, and sounds as if you were watching a TV show. Another grounding technique might be eating or drinking a favorite food. You might want to enjoy it slowly and try not to do anything else while you're consuming it, except focusing on enjoying it and savoring it, noticing it, how it tastes, the sensation, how it feels. And these are all important mindfulness rituals. And in these later third wave practices, therapists will teach these techniques to clients, and clients will be expected to practice them both in session and out of session to help them tolerate distressing feelings. Another important ritual in behavior therapy and cognitive behavior therapy is the idea of modeling. So, as the name would imply, in modeling, a client can learn a new skill by imitating another person who performs a behavior that is to be acquired. So, the way this would work, and a session would be, a counselor would model how to do some activity. For instance, maybe they were modeling, if you're anxious about how to talk to your boss about getting a raise, your therapist might model it for the client. Then the client would practice, and the client would feel more successful for having practiced it, which would, of course, reinforce that process and make it more likely for them to perform it in the future. And then the counselor there is on hand to provide feedback to the client about what worked well, what they might do differently. This can also be used in couples therapy. Modeling is used to teach listening and communication skills. So with quarreling couples, the therapist might model responses that facilitate resolution rather than spiraling the discussion downward into name calling. Another big piece of CBT is basic skills training. A lot of times people are in distress and they're suffering because they lack important skills to address the problems that they face in life. At its core, and really in the early days, behavior therapy was really considered learning theory. And I think that in terms of skills training, this makes use of that sense that what you're doing there is using our capacity to learn how to do new things as a way of improving or increasing the repertoire with which we have to engage in the world. And this really becomes important because behavioral changes, especially in CBT, can influence the way people think and feel. So some rituals in CBT are explicitly behavioral. They encourage less thinking, more doing. And the assumption is that when people learn how to have successful strategies, their cognitive schemas and feelings will also improve. A great example of this is the technique of behavior activation, which is getting clients to make sure that they're doing things out in the world if they're depressed and staying in bed all day, getting them to set a schedule where they will get up in the morning, and even if they have nowhere to go, they'll get dressed, they'll have breakfast, they'll put on their shoes. Maybe they'll do something simple like take a dog for the walk. Anyway, things like this can be pretty powerful in terms of addressing mental health symptoms in this model. Other areas that there might be skill training, things like how to cope with stress, teaching clients coping skills, ways to relax, coping with symptoms such as panic attacks, how you can use things like progressive relaxation and diaphragmatic breathing to discourage the development of a panic attack. You can also teach people how to manage interpersonal conflict, doing things like improving or teaching communication skills, or maybe improving conversational skills through the practice of targeted behaviors. An example of this might be the smile and say hello technique. In this one, say you can, if you're someone who's struggling with shyness, you can force yourself to smile and say hello to 20 to 30 strangers each day. And from there, you would experiment with that. You'd record how many people respond positively, neutrally, and negatively. And you'll often discover that people are much friendlier than you expected. And this discovery can help you overcome your fears of rejection or looking foolish. CBT can also be helpful for people struggling with organizational planning, with problem solving, with study skills. And, they have lots of techniques that can help out with that. Like I mentioned earlier when I discussed the thought log in relationship to cognitive behavior therapy, a big part of CBT is getting clients to notice either their thoughts, their feelings, or their behavior. And a common way of doing this is really through some self-monitoring homework. This can be done through paper thought records where people record their thoughts or record their feelings, record distressing situations. They can also use things like phone apps are great for CBT, or maybe 3x5 cards that they carry in their wallet, and that these records of what goes on outside of the session can be brought back into the session to examine and get some feedback on. So here would be an example of a self-monitoring ritual. So you would ask your client to keep track of repetitious negative thoughts or anxiety-producing fantasies by counting them. You could keep a 3x5 card in your wallet or pocket and put a tick mark on it each time you have a negative thought. Record the total number of negative thoughts each day on your calendar, and often the negative thoughts will diminish or disappear within 2 to 3 weeks, just by starting to notice them more. So, the relationship. So, cognitive behavior therapy tends to be very structured in practice. Each session looks the same. There's often a check-in at the beginning, a review of homework, a review of the goals, a kind of planning section where you're working really through the next steps of achieving the goal. And then the client's assigned some more homework, and then the client summarizes the session. It goes very, very straightforward, very, very regimented. It also tends to be very skills-based and didactic. So clients have something to learn from the counselor, who's equipped with a large toolbox of strategies for not only addressing things like cognitive distortions, but also for dealing with problematic behaviors that might be going in. It can be really concrete too. You can say, here's a worksheet on sleep hygiene. Now you're going to record your thoughts on a record. And really setting homework and action plans as a way of kind of getting buy-in into the process of increasing the client's commitment to therapy and also ensuring that they're, doing the work that they need to be doing. And while it is directive and structured, effective cognitive behavior therapy is also really dependent on the therapeutic alliance. The patient or the client is really actively involved in CBT. And the therapist, on the other hand, needs to be flexible and willing to listen to the patient rather than acting as an authority figure, even though they might be someone who has skills to teach. So, getting to the end here, let's think about expectancy. So, it's important for clients to have the capacity for some insight and metacognition. When we talk about metacognition, that is really thinking about thinking. Can clients examine how they're thinking? Can they remember what went through their head when X or Y happened? And can they say something about it? That's incredibly important. It becomes, if they can do that, ultimately CBT can be really empowering, because once clients realize that they have some sort of control over their circumstances, they feel really free to try it and really can quickly improve their quality of life and improve their functioning. The structured approach, where there's goal setting in each session, this is where these are our goals, this is what we're doing next, this is what's going to happen next, is often really appreciated by anxious clients, or also clients from minority backgrounds, or your textbook made the mention that men like CBT, though I don't know if that's a universal hard and fast rule, but it can also just be a really structured and predictable way, as in comparison to psychodynamic therapy, which is very ambiguous. And also, lastly, CBT has one of the most robust evidence bases, and some clients are really attracted to this, and they inherently believe that because there's a lot of evidence, this is going to be really effective therapy, which, as we know from the trans-theoretical model, when people have high expectations and they have buy-in into the process, it's much more likely to be helpful. So it kind of works to support its own efficacy. Just in terms of thinking about why CBT might be good. So the structured approach might be especially appealing to new counselors. As you're getting in there and you move into practicum and you realize, like, oh my gosh, I've got the next 50 minutes to figure out what to do with this client, having a very structured game plan might reduce some of your anxiety. And frankly, the ambiguity of open-ended psychotherapy can create a lot of anxiety for people, and also self-doubts about whether or not they're actually doing anything or helping people get better. There are lots of treatment manuals that are available. Basically, any presenting problem you can imagine probably has a DBT manual out there. And most of them are really well done with step-by-step instructions, in part because they need to have that fidelity, really, in order to prove that the treatment works. So they're very specific about how things are applied. And so that can be pretty helpful when you're just starting out. Not only that, kind of going over homework, talking through what worked, what didn't work, rather than kind of facilitating depth work, and kind of processing transference with the client and childhood experiences, just comes across as just much more straightforward. It's easier to kind of wrap your head around it. And last, just an important thing to keep in mind, that while CBT may have a very high evidence-based research tradition, and it may be really appealing as a new counselor starting off without a clear picture of what you're going to do with that client once you're in the room with them. I think it's really important to recognize that exploring maybe the schema or the source of those core beliefs about the world can be important, in addition to kind of the symptom reduction that might easily occur just with the kind of more surface level application of CBT structures. So you would think about this in terms of working through a trauma. So, maybe you would use CBT at the very beginning to reduce some of the anxiety people have around traumatic experiences, to get them so that they're no longer avoiding the people, places, and things that evoke anxiety or difficulty for them. And once they're able to kind of achieve those things, then it's important really to kind of work through and process that experience, because often there are key schematic beliefs about the self, about the nature of others, and about the world that have kind of gotten stuck and have been often, damaged by a traumatic experience, that instead of believing that, the world is safe, that others can be trusted, and that you are good and lovable, people who have experienced trauma believe the opposite. They often think the world is not safe, others can't be trusted, and I am not a lovable person. And so really, you want to make sure that you're able at some point to kind of get to those core schematic beliefs that people have, and look a little bit at the etiology of how this problem emerged. So who this might not work for, obviously clients with an external locus of control are unlikely to benefit. When I say external locus of control, these are clients that are always like, oh, it's my brother's fault that I'm suffering, or it's my son's fault that I'm an unhappy person. People that aren't able to really examine themselves and take some responsibility for their own functioning. It's probably less useful for environmentally generated problems. For instance, if you're experiencing discrimination or oppression in the world, disputing irrational cognitive thoughts really is not going to make that much of a difference. If you're facing systemic racism in your place of work, trying to get you to feel like or believe that you're not facing systemic racism in your work is not all that helpful. So changing thoughts won't change everything. And it might be less useful for automatic responses. So sort of fight or flight reactions such as aggression. So if someone is very activated, if they are, using that kind of old reptile brain, not thinking, unable to kind of get into that place where they're able to have some insight into their metacognitions, CBT might be less helpful. And here's a little bit of further reading. Thank you guys so much.